It's a great pleasure and honor to be with you today to share with you some of our work which lies at this intersection of health risk communication, health surveillance, and the rapid evolution of sets of different technologies, be it online technologies such as social media, ways in which people acquire information through search, and through the use of mobile devices, smartphones, wearables, etc. Within today's talk, I'm going to be offering some context setting at the beginning, trying to situate this work in the broader area of health risk communication, and provide some motivations for the sorts of technologies you'll see in a whirlwind fashion designed to inform different key gaps, key knowledge needs that often present within the health risk communication area. We're going to be particularly talking about this, this confluence of need to communicate effectively in the health risk area on the one hand, with the need to understand what's going on out there in the population on the other, the need for health surveillance. And we're going to be spending a fair bit of time within this talk speaking about how we can use different sets of technologies familiar to just about everyone in the room, surely, collectively, and technologies that are rapidly advancing to inform our understanding of very rapidly changing attitudes, knowledge, beliefs, out there within the population in different subgroups with respect to risks and to health risks. So we're going to be talking about search-based technologies, Twitter and social media, with Twitter as sort of an exemplar, and use of smartphones and mobile technologies as they provide insight to us to help adapt, shape, and refine our risk communication strategies that we employ, so that we could understand counter narratives that come up that may be existing in subgroups within the population, and so that we can work to adapt risk communication strategies which deal with a changing reality as far as the scientific discoveries related to the risk situation that applies, and with respect to changing attitudes in the population. We're going to be talking towards the end about a cross-channel risk communication strategy, and as time allows, we may get into a case study about how these technologies could inform particular challenges associated with communication of risk in a historic context. I'll then provide some concluding remarks to try to bring together aspects of the talk. So as a computer scientist, I'm somewhat of unusual character. I've been working for the past 20 years on the application of computational informatics tools to inform understanding of public health policy trade-offs, to understand public health trends, and to advance the science of public health. This work has evolved a wide set of different sub-areas within the health domain, but within the past 5 or so years, particularly through my collaborations with Vish, but other collaborators such as Deborah Gilk at UCLA, I've been pleased to do more and more of my work in the area of health communication, and risk communication as an important sub-piece of that. And as I came to understand that literature and came to understand many of the identified needs that are foremost within that area, several have really been of great relevance to our work and motivational for our work. The first, and we'll go into each of these in a little bit more detail, lies in understanding and tailoring messages so that we move beyond a one-size-fits-all strategy. We really understand the diversity of risk perception and attitudes out there within the population. The diversity of different narratives that different subgroups are bringing to the table when it comes to encountering the risks and messaging about the risks. Vish noted that risk, the perception of risk is in many ways a fabricated, a constructed reality. It's being shaped not just by public health agencies or other agencies of direct relevance to the origin of the risks, but also a wide variety of actors, corporate, NGO, prominent pundits and people on social media, who may command followers in excess of the hundreds of, high hundreds of thousands that watch a channel like CNN. And understanding something about the diversity of those risk perceptions out there in the population is a key need for formulating a fulsome and effective risk management strategy, risk communication strategy. The second need, the first need was about sort of moving beyond one size fits all. The second need is moving beyond this idea of risk communication as a reactive attempt to manage a situation where we formulate a fixed strategy and then simply live by it. And instead it reflects the identification of a need in the literature to make risk communication an element of an ongoing strategy, an adaptive and proactive strategy that tries to fly ahead of the plane, that tries to understand the emerging narratives, that tries to get ahead of them with appropriate messaging, appropriate trust building from the start, so that we can work with parties from different perspectives within the population to arrive at a more constructive dialogue. And part of that is a reciprocal pursuit of risk communication on the one hand, and monitoring and surveillance on the other, having a sense of what's playing out in that population so that we can respond to it adaptively. I'd like to talk about each of these in terms of particular challenges that exist pursuant to the title of the course in the 21st century, because we are in a different era with respect to the communication channels present, with respect to who the actors are at the table, and with respect to where people go to find information that they trust within the health communication front. So, within the area of tailoring messages to different subgroups, there's very much a need to understand the social embedding of risk. The fact that, as Vish emphasized earlier, our perceptions of risk are not solitudes that we ourselves come upon, but rather they're shaped in important ways by our communities and our virtual communities, the groups with whom we interact over platforms as diverse as Twitter and Facebook, through the apps that we use to support our various activities in life, and the channels that they offer for communication for corporate actors or for news sources, etc. So there's a challenge here associated with the fragmentation of information channels. No longer are we in an era where it's three major networks, NBC, ABC, etc. And you stick CNN in there and add to that a few more standard mass media channels, and you've got your channels covered. Now we're dealing with a proliferation of different sources people go to for information, which are actually, moreover, very different by subgroup. If you look at the communication channels that young people are using, it's quite different from those 20 years older. Instagram, Snapchat, etc., and the youngest groups, with Facebook having high penetration later up. Certain subgroups, very importantly, reached out to via Twitter, where yes, the TV channels are still an important player, but there's important news aggregators and different sources of information for different subgroups. Challenges here lie, in light of that fragmentation, in assessing the diversity of risk perceptions out there. Where do we go to understand what narratives are foremost in certain subgroups? In reaching key groups, these days with something like random digit dialing to get a sense of perceptions out there, you're not going to be reaching young people by and large, many of whom have no landline. They're not going to be answering calls, and you're increasingly focused on particular demographic subgroups if you're relying on random digit dialing. How do we reach out effectively to different groups who are in these available via different channels? And then how do we effectively identify and influence subgroups associated with different narratives or with contributing not so helpful messaging to the dialogue? Part of the issue here that I alluded to is that many traditional areas for data collection that we might rely on to have an understanding of perceptions out there are becoming harder to secure. Part of that is the proliferation, and part of it is just changes in the information technology environment, such as the growing shrinkage of the capacity to reach out to people simply in their homes to get survey responses. A second major need in this area, identified by reviews in the risk communication area and by leaders within that area, is the need for this to be an ongoing proactive process, not a one-time planning and then play out in terms of implementation, but an ongoing process of as I said, flying ahead of the plane, of understanding what's going on and responding to it almost in real time. And part of this, from the very start and on an ongoing basis, is a matter of trust building, of seeing what's going on out there and working to regain or gain from the start trust on the parts of different population subgroups. But it also lies in adapting the communication strategies that we undertake, because we're not quite sure of what narratives will emerge in response to our initial forays into messaging. We're not quite sure what those images, like Vish showed, of the adulticiding of mosquitoes for Zika virus might conjure up in people's minds, and what prominent voices might lift up certain reactions to those along the way. So the challenge here is particularly acute in light of the fact that people are increasingly shying away from one-way information sources, from static web pages, from information channels that broadcast to them information, and increasingly shaping their thinking based on social networks mediated online, which are a place for dialogue and sometimes bombast. So people are seeking out channels that provide them with a voice and that allow them to engage in discussion in many cases. A second issue lies in sort of understanding on a rapid basis of reactions to our messaging, being able to hear, have our ear to the ground, to hear what's going on as soon as possible following initial forays into the messaging space, so that we can shape our subsequent messaging accordingly, and to try to trial new strategies in a way that allows us to get the biggest bang for the buck. And finally, how do we maintain a sort of ongoing assessment in an economical fashion? Given that we can't do large-scale media buys every week, how do we get a sense of what's going on an ongoing basis that allows us to use our promotional dollars in the best way possible? A final need that I want to highlight is this reciprocal pursuit of risk communication and surveillance I've been alluding to. And here it's that desire for rapid understanding, the desire to deal with this proliferation of channels, to understand where are the perceptions going on the part of different subgroups, and also to understand at a more fine-grained level, if possible, the knowledge, attitudes, and beliefs associated with different population subgroups and aspects of risk and health behavior that are being practiced out there. To what degree are people shaping their understanding about, in response to something like Zika, with changing their behavior in terms of going out at dawn and dusk? To what degree are they using personal protective behavior in the form of long sleeves and long shirts to protect from risks of mosquito bites from something like West Nile? To what degree are people changing their beach-going behaviors in response to high enterococcus counts in Southern California? These are all questions we have about, how effective are our messages? Are people listening? Are they responding? And how can we do it better? So this is a bit of context setting and motivation for what I'm about to talk to in terms of technologies. And what I'm going to be talking about here is unfortunately subject to large-scale buzzwords, and particularly the area of big data and health big data. There's a lot of pundits out there, a lot of people using these terms without a clear understanding of what they mean, and sometimes without a lot of firsthand experience with them. So I want to try to convey some sense of what I'm talking about when I talk about big data here. I'm talking about channels of information, typically electronically based, which increasingly inundate our society and our science. These include social media channels, things like Twitter feeds, social media updates such as status updates on Facebook, and a wide variety of other channels within that area we'll talk about. It also includes data coming from consumer electronic devices that are consumed with rapacity by corporate actors, the Facebooks, the Googles, the Microsofts, and the LinkedIns of the world, to try to have an understanding of people's behavior out there as relevant to their corporate interests. There's also a wide variety of sensors around us in buildings. Point of sale data is used by corporate actors for decades now. It is increasingly important for marketing decisions. But we're also dealing with situations where things like web access logs, which were traditionally the province of geeks like me, the number of people hitting the website and certain pages on a website over time that might be on risk mitigation efforts related to a foodborne illness outbreak, that starts to turn into a possible source of information about how people in the population are responding to messaging that's been used in the past few days. Now, all these sorts of types of information are united by what I consider the least bad operational definition of big data, which are things that provide the evidence sources, typically electronic, that adhere to and support the 4 V's. These are volume. There's lots of it. That's the big in big data. There's velocity. It's coming in on a very fast basis. We get new information via Twitter postings. 8,000 to 10,000 times a second, there's Twitter postings worldwide. If we're looking to data from consumer electronic devices, measured, say, accelerometry, or from things like Fitbits, we're talking often many times a second. Even more important yet, for many cases, is variety. Often for the same individual, that individual is putting out information or consuming information, or is having information collected about them that is quite notable in terms of its diversity. And about that same individual for the same period of time, we may have their interactions with social media, pages browsed that are related to their perceptions of risk, their health behavior. We may also have information about their behaviors picked up by mobile devices, by wearables, etc. And finally, for many of these sources, we're replacing unreliable self-report, things like reports on people's nutrition, intake, physical activity levels, their social contacts with others, and their locations, with information that are physically measured, that are measured using technologies that are much more accurate than we know self-reporting is. So within this context, we're going to be talking about technologies that span the gamut from things that are coarser grained. They adhere to the 4 V's. They have the the volume, the velocity, the variety, and the veracity. But they're less flexible. They're more sort of broad in their picking up trends, but less detailed in the information they provide at the individual level. All the way down to, on the far right here, sort of technologies that are require closer efforts to recruit individuals, that are committed by individuals who have consented, to serve as sentinels for data collection, who understand what they're providing, but provide a finer grained understanding of health perceptions, of health behaviors, and importantly among them risk behaviors for conditions of interest. These technologies provide an understanding of an individual's particular characteristics, the audience, as it were, their context, where they are, rural versus urban, their particular context in terms of their situation within social networks, but also provides insights into their particular situation with respect to risks. Have they grown ill? Are they still susceptible? Are they individuals who have encountered the healthcare system with respect to the conditions of interest, et cetera? So we're going to be talking about a set of technologies in this spectrum, across this spectrum, that will lend insight in a way that seeks to address some of those needs identified earlier. This need for understanding what's going on out there so we can adapt our messaging strategies. This need to understand different perceptions across the population. This need to build trust on the part of the decision makers, so that the individuals in the population will feel more confident concerning the strategies undertaken. So we're going to be going through each of three strategies. We're going to begin with an aspect that's very prosaic to most of you, and it's monitoring of search volumes. The volumes of information that people are accessing information via search tools. Google search being the sort of exemplar, but others such as Bing and Yahoo search, et cetera, being alternatives. So it's long been recognized for the past half decade or so that volumes of search queries, looking at over time how many people are using certain keywords for searching out information, can provide some indications of considerable interest in the area of health decision making. Google flu trends kind of hit the world, took the world by storm until people realized its natural limitations some years back. But this has continued to be an important area of evidence once those limitations are recognized. Search behavior indicates aggregate results. We're not aware of individuals, and very importantly, we're not aware of subgroups of individuals other than in coarse geographical categories. And it's quite coarse resolution. We see what people searched with and how much they searched with it on a relative basis. However, I highlight this as an important source of information, not because it's a silver bullet. Far from that. It has manifold limitations. But what it does provide is some very important types of information on trends, on patterns, and key on the different wording that people use to search out information about similar things. Okay, we'll take a look at that. It turns out it can also provide some geographic insights in terms of trends that are quite useful, and a level of temporal granularity that can be effective in terms of informing decision making on a day-to-day basis. So I provide here a graph of the relative search volumes, for example, for Zika virus during 2016. And what we see here on the one hand is web searches in red, and news references in blue. And we see a close mirroring between the two. They're not identical, although in the first opening weeks of 2016, while well, Zika was just being highlighted within the media and just being introduced. As we know from the risk communication literature, the fear of the unknown, the perception of an unknown risk is a very powerful negative sort of motivator for people to develop adverse risk perception, to develop fear. And early on, it was an unknown, and you see a very close mirroring of news on the one hand, but people searching behavior on the other. Largely driven by news reports, likely, and largely on the basis of not knowing what it was that they were dealing with. Over time, the two depart from each other, but still mirror broad trends, and you can see on a day-by-day basis the sort of waxing and waning here. And after that point, it became, on both areas, news reports and individual searches, it became a declining trend. What's more interesting here is going beyond the Google Trends that I just showed you. There's a Google Trends site, you can go and you can put in a search term and see exactly the sort of graphs I was showing you. What's more interesting is Google Correlate, which allows you to identify other terms that very closely mirror the term that you've mentioned. So if you mentioned Zika, Z-I-K-A, it would give a set of other terms that are being searched for in ways that very closely mirror the searches for the term specified, Zika. And what you'll find here is that people search for information about Zika using a wide variety of terms, reflecting their limited knowledge. Maybe they had heard about it through word of mouth. They weren't quite sure what it was. They thought it was Ziki or Z-I-C-A or Z-Y-C-A. And they would go out and search for information on this using these different terms. And once you start putting these together with the original term, you start getting actually a much more textured picture often of people searching behavior. And it's a reflection of the fact that individuals were not familiar with this early on and were trying to find information through various types of searches germane to this. So some searching for the mosquito vector, some searching for the SIRT as an aspect of virus transmission or virus in children. And you start to get, actually, I've cut off this list, but you start to get some perception of what sorts of things are standing out in their mind in terms of searching for this and what confusions might there be. Sometimes the information available through these sort of searches can lend considerable insight into shifts in public perception of issues. This is a graph. I do a lot of work with Australian public health authorities, with the Australian Capital Territory, some with New South Wales Health, and Commonwealth Health. This particular example came out of some discussions with Commonwealth Health and ACT Health concerning whooping cough, pertussis, another area I do a lot of modeling and big data work. And what it depicts is here over time, and this is not quite sure why I guess it's just too faint here, the timeline. This is a period of a couple years. I think 2014 is on the left here, and this goes to late 2016. This is the number of searches over time for whooping cough within Australia. And what you see is a quite pronounced shift. That shift occurs right about here. It was March 2016. And after that point, you see a very different sort of pattern than before. It turns out that this lasts for a couple of years and decays away, and then it's sort of ramped up again. This was the case of baby Riley. Baby Riley was a child below 6 months who tragically died from pertussis. Baby Riley was unvaccinated, and the parents, as you can only imagine, the anguish they went through, much of their regret lay in not having sought out vaccination for this child. And the story of this child captivated the imagination of the Australian public in a way that led to a real shift in information-seeking behavior related to whooping cough. In other cases, these trends are also pronounced. This is for naloxone, opioid antagonist, which many of you are familiar with. It's becoming a tool of first responders in Canada as well as the US. What you can see is this is for Canada, with the preponderance lying in British Columbia and in the Maritimes for searches for naloxone. Again, reflective of sort of a growing awareness and reach outs for information related to this. So search trend data can give us some clues about what people are searching for, different synonyms and different ways they're trying to find, they're grasping for information about this, and some things about their perceptions in terms of those synonym terms. It can give us a sense of trends and trends that are geographically specific. But it has a number of big weaknesses. It's medium to low temporal resolution. It gives us data, every day or every week, depending on the granularity with which you're looking at it. It's difficult to interpret. It doesn't distinguish different user subgroups. All we know is counts. We don't even know if it's the same user many times or different users and really, other than geography, from where they're coming. There's many unobserved confounders. It can be used to give insight into messaging behavior. We can look at response of searches following a messaging, message associated with an advisory, but it provides limited understanding about who's responding to it. It gives some sense of how long they're responding to it. It's associated with fairly coarse geographic resolution and really no sense of longitudinal progression of a particular user, and it's far from a representative sample, although it's quite large in its inclusion of individuals in the population. It does feature as an important tool for understanding the effects of advisories and media buys. So if you do a media buy, if you put in place an advisory on one day, you may be able to use it to see a change in people's responses in terms of information seeking subsequently that gives you a sense of how long is that media buy having an effect and what is it leading people to search for, which is often interesting. I'd like to step up and talk about social media, going more towards the sort of middle of that spectrum in terms of level of insights. So all of you are familiar with social media. It's been woven into our lives and recently into the politics of the US and Canada to a degree as well. The shocking information on what companies were able to acquire through Facebook data is not unfamiliar to technologists like me, but it's hit the political world like a ton of bricks, and for good reason. I've highlighted up here a set of social media platforms for a couple of reasons. One is to communicate there's a wide variety of different platforms out there. Two, to note that different of these platforms have uptake in very different communities. QQ Chat and WeChat, very widely used within Asian communities. WeChat is the dominant platform in China. It's used for everything from buying groceries to unlocking doors to information about exchanging information with people. It's replaced email as for many types of business communication, and it has penetration that is absolutely remarkably large and remarkably quick, the time in which it's occurred. Something like Viber is a tool that's widely used in the South Asian community. Bangladeshi, Indian, Pakistani individuals, including many here in North America. And of course, many of you were familiar with Twitter, microblogging platform, and with Facebook, for better or for worse. Other tools such as Snapchat, Instagram, YouTube, etc., are very popular among young people, especially popular among young people. You may not think of YouTube as a social media platform, but as someone with a large YouTube presence myself, I can assure you it most certainly is a social media platform, and it is a platform of great interest in terms of health communication, given the amount of information that's posted there, often on an ongoing basis, related to health crises and related to messaging, etc. I've highlighted in green here particular channels of great interest from the perspective of the fact that they are public sources. They are publishing channels. And as such, they are contributed to by individuals with a recognition that what they are contributing is in the public sphere. And I contrast that to something like Facebook or WhatsApp or WeChat, where the expectation is typically that this information is going to, it's not personal, but it will be shared less widely. And much of Facebook's problematic conduct has been in trying to blur the line between what is sold publicly and what is private, of course. But the green channels are ones that we, in our health work, have tapped very strongly, recognizing that these are public messages, and our ethics boards are very comfortable with tapping things that are essentially self-blogged contributions, whether it's on Tumblr or on something like Twitter or on YouTube. So social media provide, in contrast to search data, they provide an understanding of the diversity of expressed attitudes and beliefs across large swaths of the population. Here we can really get a sense of different voices within the population and different subcommunities. You know, people who are following others, individuals who are tied together in subscription networks, etc. We need to be very aware of changing attitudes towards privacy in public and platform developers and regulators. For example, Instagram had a very big shift in their privacy-related policies in 2016 that has required a reworking for those who are monitoring for information on their reworking of how they approach the platform. And of course, Facebook has over the years modified their policies with respect to sharing information, although in my view they have fell well short of the types of privacy guarantees they should have provided. There's a profound diversity amongst these different platforms. There's no one-size-fits-all to monitor them. And I want to highlight the fact that beyond serving as an important source for insights about health communication and response to messaging, etc., these tools are very important in two other related features. Number one, as a highly effective shapers of opinion. It's not merely that Facebook and Twitter and Tumblr, YouTube are reflections of people's attitudes in the population. It is further a reflection of the fact that the materials on there are shaping population perceptions with respect to these issues. They are shaping the perception of the risks on the parts of others. And as such, it is a very important channel to contribute to further shape that discourse in positive directions. Finally, social media are a highly effective targeted social, they're very effective at social marketing. We've used Facebook and I think very highly of it as a tool for putting out messages that draw in individuals to serve as fully consenting in a very informed way for our work with sentinels to carry smartphones for more detailed understanding of their knowledge, attitudes, beliefs, and behaviors with respect to health. So these are formidable tools when it comes to recruiting individuals for more detailed focus discussion. So social media, as I noted, are highly diverse, and they're highly diverse in many characteristics. I'd like to focus in on one particular platform for some of my examples, and that is Twitter. We do a lot of work with Twitter. Twitter is a platform of great significance worldwide. It has over 300 million users worldwide. about 100 million of them active. In the US, the numbers are somewhere short of 70 million active users. It's very high volume. It's somewhere in the order of 8,000 to 10,000 tweets per second. And approximately 3% of those tweets are health-related, we've found. We've done extensive work, and I've spent a huge number of hours personally going through Twitter messages, which is not my foremost behavior of preference, but it is instructive as to what's out there. And it's roughly 3% of tweets are health-related. Geotagging and geoinferencing, and I used that second term cautiously, but I could explain what I'd mean if there were interest, is possible on many tweets. And what this means is that you can figure out for a large fraction of tweets where they're coming from, to the level of city, province, etc. About 2%, 2 to 5% of tweets, I think it's grown some, are explicitly geotagged, meaning they have GPS tag. And so you can have very precise locationing associated with the tweet. And you can filter this sort of content by the text, the time, the geography, and crudely with existing tools, more precisely with custom tools by sentiment. The attitudes they're bringing with respect to the tweet contents. Negative attitudes, so if they mention tobacco, are they doing so or e-cigarettes in a positive way or a negative way, etc. You have to be very careful there. There's it's areas at the forefront of research, but there's a certain amount of sentiment analysis that can be reliably done. Moreover, beyond the tweet message itself, we get a great deal of understanding from things like likes, retweets. The fact that this was retweeted many times provides a lot of information beyond the time that it was tweeted in the first place. And we can perform ongoing analysis as tweets come in, or we can perform some retrospective analysis with enough investment in the requisite infrastructure. So if we were to look at patterns of use, they differ a lot by condition. This is from one of our neighboring provinces, Alberta. We do a lot of work, traditionally with Alberta Health Services, and some with the Ministry of Health in Alberta. And this was related to suicide. And what you'll see here is very indicative of certain types of conditions where you see episodes that are very pronounced and then a very rapid die-off. Within about 3 or 4 days, the level of interest sort of drops off. And if you go into more detail about what are these suicide-related tweets, you will find a diversity. And I apologize for some of the language up here, but these tweets were selected by me as sort of exemplars of very different sorts of tweets that will, from a naive perspective, be taken as sort of suicide-related, right? Some people are talking about something that is little to no relation to human health behavior. Others are making comments that might be a joke, you can't quite tell, but maybe there's some ideation under the surface. Others express, frustration. Others seem to be very worrisome messages on people's parts. You will find messages of social support. You will find messages of despair. You will find messages of public health messaging. A wide variety of types of information in here. Interestingly, the discourse and the patterns, the waxing and waning of patterns on Twitter often mirror underlying advisories and in public health messaging. So for example, in the Canadian context, air quality advisories, I showed this for actually our home province, and what you'll see is sort of big uptakes at the time of an advisory, and then sort of a decay, a discourse related to that topic. And often the types of information present here indicate a lot about how people reacted to this message. What was their response to it, and what aspects of that narrative caught their attention? Very valuable if you want to shape that message for future message buys. Which part of the message did they ignore? Which part of the message did they take up? And what you'll often see is a characteristic pattern where it decays almost exponentially. Sometimes it's within 2 to 3 days or 3 to 4 days. Other times it lasts a week, a little bit more, but you see this very characteristic decay. In some versions of this talk, I've provided a walkthrough for some of the tools. We don't have time to do that, but I would recommend something like TweetDeck for keeping abreast of the tweets. And I'd also, for anyone interested in bigger investment, it's freeware, it's open source software, so it has no cost, but it does require certain IT investment. There's a tool called Social Feed Manager that serves as kind of an aggregator of this data from online. You can use to follow Tumblr, you can use to follow Twitter, you can use to follow news queries, etc. What are the weaknesses of Twitter? If we focus on Twitter as an example of social media, well, it is a disproportionate focus on a vocal population segment. And it's not very widely used among low socioeconomic individuals, and that's a big point of concern if you try to use it to judge discourse out there in society. It's a big gap. If you approach it as representative of a subset of the population, you can be in good shape. If you approach it as representative of the whole population, you're going to be misled. And you will be putting blinders in front of your minds in some of the most important groups to reach out to. It's hard to do precise geographic filtering. It's hard to make sense with certain tweets. Again, are they a joke? Are they not? And the types of sentiment classifications you get out there through existing mass tools are often of poor quality. Flexibility in it requires typically programming or paid services, although again I'd recommend Social Feed Manager as sort of an open source solution that's effective. And the real challenge within the social media area more generally is just staying abreast of the current state. This fragmentation of channels is not a one-time thing. It's not like we're going to get our handle over it and be good for the next 20, 40 years. Every few years, the pattern of what young people are using shifts. People shift in their balance of uses. What sort of people go to Discord versus Instagram versus Snapchat versus who stay on Twitter? It's just an amazing rapid evolution, and you need to stay abreast of that. We'll see with smartphones how we can do that. Okay, how we can get insights into this. What does this give us, though? Well, it can give us, in response to social media buys, attitudes for different subgroups, different particular channels as well, how people are reacting. What are the counter-narratives that are coming up out of your media buy for skeptical parties? What are the counter-narratives on the basis of fear that are coming up? How do people react to their counter-narratives? How many of them are liked or retweeted on? This can give you a real sense of that. And it can give you a sense of misunderstandings or misperceptions that are coming from the media buy that can be very helpful for shaping your communication. This notion of adaptive communication tied in with surveillance. We notice what the discourse is in response to our messaging. We respond accordingly with refining our strategy, with building trust in areas where it seems to be lacking. We can get some understanding of the attitudes and beliefs associated with different subgroups, and we can react accordingly. The final sort of technology sphere that I want to talk about, though, is one I've invested also, beyond those first two, a great deal of my personal time in. And that has to do with smartphone-based monitoring strategies and strategies that tap associated wearables, such as the Fitbits, the Mio watches, Hex shirts, etc. These are monitoring systems that are based on smartphone apps. They are for consenting adults who require briefing on what they're agreeing to provide, and therefore it's restricted to sentinel subsets of the population. This is not something you ask everyone, a given area to do. It's something you recruit people for to serve as sentinels, and it takes advantage of the fact that we have a very high penetration in US, in Canada, in Europe, and indeed in many areas of the world, in China, of smartphones, and particularly iPhone and Android smartphones. I'm a software developer by profession. Before I was served as a professor. I served in the software development area. I teach software engineering. And this is an area we've used for the better part of a decade, building tools to enable health monitoring in this area from consenting adults, and adults who have a good understanding of their privacy options and can snooze the data collection at any time. So the platform that I'll be talking about is one that was spun off from our lab. It's a small company with which I am involved, which is called Ethica Health. It's a Canadian-based company at ethicadata.com. And fundamentally, it collects three types of information. It allows you to issue, without programming, these ecological momentary assessments, these kind of mini questionnaires that allow you to probe people's reactions to issues you're interested about. So a given use of this will have different EMAs that they use, different of these little micro questionnaires, to probe knowledge, attitudes, beliefs, behaviors with respect to it. It might be personal protective behavior with respect to Zika. It might be your beliefs with respect to the vaccination messaging that you're hearing. It might be beliefs with respect to e-cigarette and cigarette interactions. These sorts of studies have given us profound insights that we never would have anticipated about people's beliefs. Things like there's a certain subgroup of the population that believes that e-cigarettes are protective against cigarettes, meaning if you use e-cigarettes, and then subsequently smoke a cigarette, it will actually make that cigarette do less harm than if you hadn't used the e-cigarette. In that sense, it actually promotes continued use of cigarettes being seen as just a prophylactic measure to protect you against them. So you can issue these questionnaires and EMAs. You can also monitor sensors, and you can elicit reports from individuals who might want to report something like, I saw a Lyme disease advisory, I encountered this, or I removed a tick, or I have a rash. They might report information of interest to the authorities running the program or study of interest. It can deliver adaptive messaging over time as needs change. You can use it as a channel for putting out information to these sentinels. And for simpler studies, it's programming free. This is not something that requires new programming for every study. And it has interfaces for wearables. So for example, an individual might push a button here, and it might call up a mini survey which talks to them more about it. So they might say, look, I encountered a Lyme disease advisory, and it might ask them, how did you feel about that advisory? What did it make you feel about your risk? What's your current perception of risk? What do you, are there things you're confused about? What do you wish that advisory had contained? And we've done this for dozens and dozens of studies around the world, predominantly in Europe, Australia, North America, for different types of health needs. So the questionnaires are quite specific to the needs. These questionnaires can be brought up in response to that button push, but it can also be brought up in response to a certain time of day, or just with a certain chance per day. It could be brought up at dawn and dusk, for example, for personal protective behavior related to mosquito-borne vectors. Or it might be brought up first thing in the morning for an individual who has to take medications at that time. Or maybe it's brought up when they're in a certain location, a certain area, a park, and they want to know why did they come to that park. What brought them there? For what reasons are they outside for a long period of time? So these can be contextually triggered by their context or triggered by their behavior. And it can record things like the time it took them to respond to the survey, the time they reviewed certain questions, so we have a sense of how long were they dwelling on certain questions. And they can use the audio and the photos to lower the burden to themselves to report and to provide more accurate understanding. They can take a photo of the rash or a photo of the tick that they removed, which provides some understanding of what they've been exposed to. Now, how does all of this technology have anything to do with risk communication? Well, it has to do a lot with risk communication. The potential for informing risk communication with this tool is what motivates some adoption of the tool. So one thing is it can help you gather information on the individuals. Those EMAs, those ecological momentary assessments and baseline questionnaires can clue you into who you are. And then over time, you get an understanding of their context through their location as picked up by the phone, through their level of physical activity in terms of aspects of their situation, their closeness to certain outbreaks, etc. We can also use it to understand communication channels. So we can look at what channels are people using. Not so much because necessarily we want to reach them through the phone, but because we'd like to have our monitoring going on channels of foremost use by the subgroups in the population. And if these people, if a person is reporting important aspects of risk perception that we feel we need to address, we can have an understanding of their balance of channels that they're using, how much time they're spending on Facebook, for example, or YouTube. To what degree are they relying on browsing? To what degree are they a Snapchat user? And this could provide us some understanding of where they might be drawing their information from. In other studies, as with studies with Vish, we've looked at actually recording what information exactly are people encountering with their browsers. What are the messages on the pages that they're encountering with respect to smoking, or with respect to alcohol use, or with respect to opioids, to be able to understand something about their message exposure. Message exposure from public health authorities, but also message exposure from other corporate actors. And this includes two types of exposure. Physical exposure, we might be interested in to what degree are they encountering billboards or gas station ads related to tobacco, or to what degree are they encountering things online, messaging which is invisible from the standpoint of traditional regulation of messaging and newspapers and magazines and billboards, but which is making the way into their consciousness through their online exposures. So tools like this have allowed us to map out, where have messages been encountered by individuals? What are the sorts of those messages? Are they sort of fixed messages like a billboard or an ad in an ad in a bar or in a gas station? Or are they short-term messages such as they might see on TV or on radio that might warn them against the dangers of tobacco or what have you? So we can map out where they're encountering these messages and who's encountering the types of messages that they're encountering. We can classify, for these individuals, they've encountered them in these places. And we can know something about their reaction to those attitudes through the phone, following before and after, sort of pre and post exposure, as it were. What are their knowledge, attitudes, and beliefs? How does it change for exposures if we're asking them at the time that they see the ad versus after they've seen it for some amount of time? What are their attitudes towards tobacco smoking? We can elicit that understanding using this phone, having known that individual has been exposed. We can also look at things such as how has their behavior changed in response to a foodborne illness outbreak. So where were they going before in terms of eating? Where were they visiting, and where were they going afterwards? Or in terms of advisories for beaches in Southern California, are they continuing to visit the beach even though the high enterococcus advisory has been being promoted for the past several days? So we might look at, where are they eating out within the population, and where were they eating within 24 hours before they reported a credible foodborne illness, case of foodborne illness. We can look at location over space, and for some studies, we've looked at contact patterns, contacts between individuals within a population. And during a pandemic flu, for example, we did this, looked at how that changed over time, and that can be related to the advisories that they were exposed to. We can also do that with other actors. In some cases, we've done it with, for example, service dogs, and looked at animal-human pairing. So there's great advantages toward taking the information from the phones and linking it up with other sorts of data. An obvious example is GIS data, Geographic Information Systems, data that contains information on where these places they're visiting we recognize through the GPS. Are they visiting fast food restaurants? Are they visiting beaches? Are they visiting beaches with known closures? Are they visiting beaches with posted advisories? In other cases, we link it to weather, or we link it up with their browsing behavior as collected via the smartphones or with smartphone media use. So our partners at the provincial level in multiple provinces now have sought to make use of a strategy that I briefly summarized here as it would be applied to the risk communication context. So basically you recruit a sentinel panel of community participants. The panel members go through an informed consent process. They download the app and they decide whether or not they're going to opt in. And if they opt in, they enter a code which basically indicates the particular study or type of data collection initiative that they're part of. We collect their baseline data, which often is quite extensive in terms of the audience, their characteristics, their context, and other components. And then we iterate. We go through and going through advisories. We monitor their response. We look at their knowledge, attitudes, beliefs, and behaviors, how they respond. And we update the survey instruments and crowdsourcing buttons to collect the data better and update the advisories and quality of the messaging. An important component of this has been community sharing of the information collected. So in terms of building trust, not only these sentinel individuals sought out by this and provided some compensation for their time, they are additionally, in some cases, they're provided with opportunities for sharing proactively, choosing to share some of their information. This is the type of thing which you might allow them to opt out of or opt into, and you might allow them to share their pictures of things that they've submitted as of concern back to the community for certain types of needs. So we've done this for areas, for example, related to physical activity and messaging related to physical activity, promotions for physical activity. People can share information about what draws them out to engage in physical activity, what are the barriers in their community. So it's an aspect of sort of community sharing of perceptions, etc. And this has been an important tool for building trust and building behavior change, building opt-in by individuals, and in some cases adherence as well. We provide the information back to them on an as-willing basis. So the cross-channel approach that I'd like to advance in this area is one that doesn't look to any one of these strategies, to search behavior, to social media, to smartphones as an end in and of itself. Rather, it weaves together multiple components of these into a cohesive strategy. And this strategy includes using smartphone apps with Sentinels to understand the diversity of channel use out there. What are people actually accessing for their online channels? Are they relying heavily on, for example, Instagram use for a lot of their social media? Are they heavily on Twitter? To what degree are they seeking out information via browsing behavior? And to what degree are they going to channels of known quality, such as might be supported by health authorities, or to what degree are they going to channels that are of more questionable vintage? Secondly, we use social media over time to understand the impact of messaging that might be bought by health authorities on discourse. So this would be to what degree are people echoing the messaging? To what degree is there a viral effect with some of the messaging? How long does the effect offer, and what are the counter-narratives? What are the aspects of it people pick up on to try to argue against it, and what are the aspects that people pick up on as the salient points to echo on? So this provides some picture, an operational picture of how people are reacting as through the lens of social media to this advisory. Because this information doesn't have cost to collect it, it's a particularly attractive strategy to couple with the very substantive costs associated with media buys. And social media provide this kind of window that's low cost view of, okay, what are the reactions going on out there in the population? You can look also to search volumes, starting the very next day. You know, is this triggering more information searching? You can look to web logs. Is this triggering people to come to our website as hoped? Are people indeed coming to view the information as linked to within the site, etc.? The smartphone app can be used with sentinel groups to understand things in more detail. Aspects of message exposure. Where are people encountering it? What is the impact on their knowledge, attitudes, beliefs? And to what degree is it actually rippling through to impact aspects of their behavior, personal protective behavior? You know, changing their behavior going to the beach, to wearing the hats and long sleeves and long pants on a hot day to protect from West Nile. To what degree are they in fact you know, still engaging in waterborne activities or visiting the same restaurants? To what degree is that advisory changing their behavior with respect to food seeking? It also allows us to understand more about the particular audience and the context. Who's responding? How are they responding? That can give us understanding to further refine our messaging. We can trial messages on a cross-channel basis. We can trial messages for lower cost online and see what sticks, see what messages actually make it out there in terms of going viral, see what messages are passed along. And we can share, in certain cases, information with respondents that may help further build trust. So if we look at those, we reflect on those needs from the literature that we started with an hour ago. This need to understand and tailor messages to address the diversity of risk perception and attitudes. I think it should be fairly clear about how these methods can give us insight into that. We hear these different narratives online. We see different subcommunities with different discourse related to risk as they are manifested on different components of social media and as they're crudely manifested in searching and for our sentinel groups. As far as social embedding of risk perception, well, that's why we're going to social media in many ways, because people's impressions are not just shaped by the one-way news channels that broadcasted them. They are shaped by the communities with which they affiliate online. And we can get some understanding of that through online channels. Risk communication here is seen as an element of an ongoing proactive process, an adaptive process. And it's a process that stimulates learning on the part of health authorities and indeed on the part of the broader population and other important stakeholders, NGOs, etc. So here, risk communication is a process that is undertaken in an open way, seeing the reactions and responding to them, and responding to fill the gaps in understanding and in trust. We can use it to assess risk interpretation across different groups, to engage in elements of trust building, figure out where that trust is most keenly lacking, and to adapt the risk communication strategies. And finally, there's this notion of pursuing the risk communication and monitoring surveillance as a whole, together, jointly, to greatest insight, and that's what this whole strategy sort of relies on. I was going to talk about a case study, but to open time up, particularly for questions, I think I'll go short on this. It was one focused on West Nile virus. I've done a lot of my work professionally on West Nile. It's involved a great deal of modeling work, as Vish alluded to. It's also involved a fair bit of work on large-scale data collection in the field and with social media. And if we look back at the New York City experience with West Nile, the New York City authorities undertook a lot of savvy approaches to this. They were familiar with the asymmetries in risk perception. People's negative messaging can have a disproportionate impact compared to positive. They were aware of the different factors, such as fear of the unknown, that come into risk and which played a big role in this new zoonosis as it emerged for the first time into North America in New York City, coming from the Bronx Zoo. But at the same time, those in the literature have analyzed this case and found important gaps, and some of them are here. Little sensing of the risk perceptions out there. They were aware of what the issues could be, but they had less sense, particularly in some subgroups of the population, in a context where, like Vish's picture, there was adulticiding going on. There was spraying of insecticide. There is a failure to be aware of certain subgroups, like asthmatics, for whom this was a very significant issue that went beyond just skepticism. It was rather an issue of their health and fears for their health. There was a disconnect in terms of updating certain subcommunities with respect to the actions taken. And there's a lot of potential for the sorts of technologies we're talking about here to give to fill in some of those gaps, some of the gaps which the New York City authorities, despite their really good efforts in other fronts, fell short of in terms of sensing the risk perceptions on social media, in terms of inquiring about risk behavior and measuring changes in that, in terms of understanding the different messages out there from groups such as individuals with health issues that might be affected by some of the actions undertaken and messaging in response to that. There were certain time and location specific advisories and reminders that were given out to individuals as part of this. Draining standing water, use of personal protective behaviors that could have been really enhanced in their impact if they had been timed over Twitter or via an app at the right time. You time, a standing water advisory following a rainfall and at the right point. Personal protective dawn and dusk, and before a long weekend, you get those messages out related to personal protective behavior. But to undertake this in an adaptive way that reflects the context of the individuals involved is particularly powerful. So a couple of take-home messages from this. Surveillance is a key aspect of risk communication. We traditionally, thought of as risk communication as one thing, health surveillance is another. But they're really joined at the hip in order to inform adaptive risk communication that really shapes the messages based on the encounters with the counter narratives and the response of the population. It allows us to assess a baseline, assess change, and to inform course corrections based on our observations. In today's environment, because of the proliferation of all these different channels, Facebook, Twitter, aspects of web blogs and more general one-way websites, yes, TV, cable channels, also things such as Instagram and community-specific things such as WeChat or Viber, etc. It's difficult to inform many in a traditional fashion. With people going offline in terms of their landlines, traditional message of surveying people are harder. And new surveillance technologies, such as we'll be talking about, working across multiple channels, can provide us a way to assess attitudes, beliefs, exposures, and even behaviors in ways that are currently actionable. They do have limitations, but they can also fill important gaps with other strategies. And there's big areas where we, in coming years, can look to growth and refinement. And a key use of this data is to learn more quickly in evaluating our strategies, evaluating and refining our risk communication strategies. so that if we don't see success in nudging behavior, we at least know something about why we didn't. What was the narrative that shot that down quickly, so we can change our communication efforts. We can inform our efforts to be more savvy to the subgroups involved as we hear their voices online. So I'd like to offer my thanks to those who have made this possible, to Vish for the kind invitation to come here, for Rachel for helping out.